This is the JTV Caribbean News. I am Sean Rose. One individual, possibly two, infected with the Ebola virus were identified on the Carnival Magic cruise line, according to reports coming out of Belize. Local TV station Channel 7 in the capital city of Belmopan reported having credible reports that a couple from the Texas-based cruise ship anchored off Belize City was on a ship tender, unable to return to the cruise ship while being refused entry to Belize City to catch an air ambulance awaiting at the international airport to take them to their country of origin, the USA. Belize health authorities refused to deny or confirm the report. The patient exhibiting Ebola symptoms was confirmed to be a nurse at a Dallas hospital traveling with her husband. The ship is reportedly carrying 3,652 passengers and a total population of 4,633 persons. The Carnival Magic departed from Galveston, Texas on Sunday, October 12, and arrived in Mahogany Bay, Honduras on Wednesday, October 15, and then in Belize on Thursday, October 16. The ship was scheduled to leave Belize en route to Cozumel Friday evening at 5 p.m. However, up to news time, it was still anchored in Belizean waters. Antigua and Barbuda Prime Minister Gaston Brown has called on residents to engage in a cleanup exercise following the passage of Tropical Storm Gonzalo on Monday. The seventh named storm of the Atlantic hurricane season swept over Antigua, downing power lines as well as causing floods in several areas. Initial reports indicate that roofs were blown off several houses and residents reported downed trees, billboards, and power lines, as well as flooding as the storm intensified. Gonzalo also triggered an island-wide power outage and forced the closure of schools and businesses. Prime Minister Brown said the damage exceeded what he had anticipated, and his administration is prepared to provide assistance to persons who have suffered extensive damage. The Pan American Health Organization, PAHO, wants healthcare workers throughout the Americas, including the Caribbean, trained in the use of personal protective equipment and early identification of suspected cases of Ebola. PAHO's call comes amid confirmation of Ebola cases in the United States. PAHO also reminded countries of the importance of maintaining surveillance and updating their procedures for any potential introduction of the virus. PAHO said healthcare workers are at risk of infection with Ebola unless they take adequate precautions, noting that in Africa, healthcare workers have been one of the most heavily affected groups, with 416 cases and 233 deaths. The virus is not airborne but is transmitted through direct contact with the bodily fluids of infected people. PAHO reminded member countries of the need for measures to ensure early detection of potential cases. These include heightened awareness among both screening personnel at points of entry and healthcare workers on the clinical features of the disease, especially fever, and screening questions about history of travel to Ebola-affected countries or other means of exposure to the disease. And Cuba is providing support for those who are stricken with Ebola in West Africa and has sent 62 doctors, 103 nurses, and all of the necessary logistical and medical support its team needs to help stem the epidemic in Sierra Leone. Cuba now has in place the largest medical team from any nation, and after it has made other Cuban medical personnel Ebola ready, it will send a further 296 doctors, nurses, and support staff to Liberia and Guinea, the other African nations most affected by the disease.
Cuban health workers suit up to fight Ebola. Right now, it's just practice. But soon, they will be facing the real thing. This medical institute in Havana is the island's Ebola boot camp, providing a grueling 2-week training course before workers head to the front lines of the epidemic in Africa. This is where the Cuban doctors and nurses practice treating patients infected with Ebola. They have to repeat these procedures again and again because a slightest mistake in the field could have fatal consequences. Already, 165 health workers from the island have been sent to West Africa, with close to another 300 soon to join them. All are volunteers, officials say. For at least 6 months, they plan to treat people infected with Ebola. Before they go, they learn how to put on and take off 7 different pieces of protective equipment, leaving no gaps where Ebola could enter. Despite the training, officials say they will be in constant danger. We've instructed them so that they will not get sick, but they are at great risk, he says. It is our hope that none of them do get sick. We have the conviction that perhaps a few will fall ill, but the majority will not. The peril they face, Dr. Osmani Rodriguez says, will force them to stay focused.
To be afraid is not a big problem. I think that being afraid will help us to protect even more against that viral disease. Because if we feel that we are so sure about everything we are going to do every day, it may be more dangerous than being afraid of the disease.
Cuba is, by its own government's admission, a poor and small country, but it has taken the lead in fighting Ebola.
And we hope that Cuba example will probably take the scare that's behind going to work in West Africa. Probably people would be a little bit less scary and accept this health challenge to go and provide assistance to the African population.
Cuban officials say they are doing what they can, but to stop the epidemic from spreading further, the fight against Ebola needs to become a worldwide effort. Patrick Ottman, CNN Havana.
And finally, in this week's Caribbean News segment, the government of St. Lucia has imposed travel restrictions for persons from Guinea, Liberia, and Sierra Leone. All visitors from the 3 countries will be denied entry into St. Lucia until further notice. Visitors from Nigeria will be required to present a recent medical certificate which clears him or her of the virus, in addition to a visa to be allowed entry into St. Lucia. Meanwhile, Grenada has called for a joint OECS position on the outbreak of Ebola, and St. Vincent and the Grenadines announced a ban on visitors from the African countries. At a recent Council for Human and Social Development meeting held in Washington, CARICOM countries were updated on the protocol necessary to fight Ebola. That's it for the JTV Caribbean News. I'm Sean Rose.
And coming up next on JTV News, the government says it is proactively planning mitigation measures to manage the impact of Ebola. JTV News gets one local doctor perspective. Police officers get training in life-saving skills through PAHO Emergency Care and Treatment Training Program.